Hi, my name is Geraldine Bates. Welcome to my presentation. Today I will be discussing gender dysphoria in rural areas. Gender dysphoria is a complex medical condition characterized by distress or discomfort due to a misalignment between an individual's assigned sex at birth and their experienced or expressed gender identity. It affects people of all ages and it may have a severe outcome on their mental health and general feelings. Therapy regimens involving hormonal approaches, surgical interventions, and psychotherapy are popular due to the result in suppressing the symptoms of gender dysphoria and improvement of the overall quality of life. Although the availability of expert care for gender dysphoria can be problematic, especially in isolated areas, it can lead to inequalities in healthcare access and results. The consequence of challenging sites of care delivery in the era of gender dysphoria is out-of-the-box solutions in the form of virtual interactions between healthcare professionals, thus breaking the barrier of geographical position between the total number of care providers and patients. This paper will propose an evidence-based care plan that aims to enhance the safety and prognosis of a 25-year-old transgender male living in a remote place where access to primary healthcare services is limited. Besides, it will describe the impact of evidence-based practice on forming care plans and discuss the utilities and constraints of long-distance teamwork. Formulation of an evidence-based care plan for a 25-year-old male-to-male transgender person with poor healthcare services in rural zone necessitates a holistic-based approach to account for both physical and mental health needs while factoring in the problems that come with remote collaboration. The aspiring plan will upgrade how the patient operates by integrating the basic principles of evidence-based practice and using interdisciplinary collaboration, according to Cooper et al. 2020. First off, the history of the present illness should be questioned to exclude symptoms which are similar but do not list gender dysphoria as their diagnosis. Such evaluation will mainly involve a team that combines psychiatrists, endocrinologists, nurses, and surgeons working together and conducting remote psychiatric interviews and physical exams, according to Cooper et al. 2020. Furthermore, additional lab tests are performed, including hormonal levels, a CT scan, an X-ray, and an MRI to determine the correct diagnosis to be reached. They are applying the plan, monitoring results. The treatment strategy has to be gender dysphoria specific. Besides that, a concerned person could also be covered with the person's goals for treatment. Creative writing prompt. The art of stargazing in our everyday lives. Supervised use of hormonal therapy, which an endocrinologist directs, is the main component of male hormone therapy for transgender males. According to Collado Milano et al. 2020, they pursue the treatment in line with their specific perception of gender, which is used to overcome the discomfort caused by bodily form. This is a great way to help control the patient's discomforts and thus promote their quality of life. A crucial part of the treatment will be constant monitor of hormonal levels and the possible side effects this may provoke to ensure the safety of the method. Combined with hormone therapy, psychotherapy is of particular importance for them to deal with psychological distress because of gender dysphoria and to live up to the norms which are associated with the treatment. In opposed, cognitive behavior therapies and other evidence-based methods have a potential impact on customers and even have the skills how to cope with discrimination and stigmatization. According to Boucher and China 2020, online therapy with credible mental health professionals will allow the patients to admit to care while away from the home environment and create a support network to ensure the continuous support of the patients. A surgical intervention such as a chest masculinization surgery or genital reconstruction surgery could be a part of a medical plan given the patient's values and medical eligibility. It is imperative that partnering up with experienced surgeons who are used to dealing with the specificities that pertain to transgender healthcare is an absolute necessity in the line of ensuring the safety of these operations and the success of the entire process. Precise preoperative appraisals, along with the informed consent mechanism and consequential postoperative improvement, are the key therapeutic settings for the treatment of transgender dysphoria. According to Boucher and China 2020, frequent and evident communication and cooperation among all the transdisciplinary team members form the basis of a good treatment schedule, patient monitor, and possible troubleshooting problems, which eventually lead to success. Interactive telehealth platforms like virtual consultations and home monitoring have a fantastic power to open continuous communications and information avenues. It provides more comfort to disabled individuals and those residing in rural areas who are unable to travel to health providers given the geopolitical barriers that may be present. The development of the design framework of the evidence-based care plan for non-patients with gender dysphoria employs a systematic process that considers the EPP principles to start. We conducted a thorough literature review on all kinds of treatment approaches for transgender individuals, like hormonal therapy, surgical operations, and psychotherapy was carried out. The literature review allowed us to search for current evidence of safety, efficiency, and quality of treatment and outcomes that is relevant for assisting us in mapping out the care development process. Generally, a part of our research reviewed the literature that was provided by established associations like the World Professional Association for Transgender Health, WPATH, as well as the Endocrine Society, according to Mason et al. 2023. This was done to conform to the best practices in transgender healthcare. Study guides that provide investigators with advice tend to help professionals in patient care pace themselves so that such tools can benefit others. Moreover, the physician consulted the patient's feelings, values, and particular care objectives, which help form part of patient-centered care that is based on clinical evidence and guidelines. In this way, the doctor will include the patient in all the decision-making processes and give more comprehensive clarification of specific cases concerning the concerned specialist for the treatment of the patient. Lastly, continuous monitor and quality control techniques will constitute the essential components of the care plan for the care provider. At the same time, they will be used to evaluate the care plan's effectiveness and update the current evidence should it become available. According to Mason et al. 2023, regular interdisciplinary team-up sessions and case conferences could be grounds for the feedback, discussions, and improvement of the care plan, since this is based on actual results and information solely from the patients, resulting in evidence-based and patient-oriented care. Through planning the care regimen, several pieces of evidence have proven to be highly helpful in ascertaining that will benefit the patient. Research studies concerned with the safety and efficiency of hormone therapy in transgender people provided crucial information relating to the probable gains of the hormone treatment that masculinized them and guided the treatment planning and clinical follow-up. According to Malona et al. 2020, additionally, research evidence that the therapeutic interventions effectively address the distress related to gender dysphoria and increase psychosocial well-being motivated the inclusion of psychotherapy into the treatment plan. Unfortunately, such guidelines and consensus statements were also released by WPATH and the Endocrine Society, professional organizations that established them to help patients with gender dysphoria. These rules are of central importance and support physicians in their daily routines. This set of guidelines showed a path for making treatment plans coherent and scrutinous with the existing standards of care by using evidence-based medicines approaches and the existing principles in transgender healthcare. Additionally, the whole team of internal specialists such as psychiatric, endocrinologists, nurses, and surgeons are crucial participants in implementing and applying specific clinical manifestations and patient preferences. According to Cooper et al. 2020, the use of many people's expertise and different points of view widen the care plan, but still according to the principles of evidence-based care. Rural healthcare professionals working on the patient above case offer numerous advantages regarding care delivery to a certified gender dysphoria client in a rural setting. This type of treatment gives the patient access to professionals and resources that are unavailable locally and helps improve their health. According to Boucher and China 2020, thus, the scope of treatment methods is expanded, thus the quality of those treatment methods becomes much better. In the practice flow, the web-based partnership made it possible to contact mental health specialists, endocrinologists, and surgeons who have long-time experience in transgender care and may give the best treatment. Additionally, remote working encourages interdisciplinary communication and coordination that support the scrutinized application of professional services in different healthcare domains. Using teleconference, electronic health record systems, and virtual consultations, the member of a professional healthcare team can exchange information, share updates, and coordinate care plans efficiently and without interruptions so they can concentrate on the patients they are responsible for. Besides this, the smoothly running communication builds collaboration where the knowledge and excellence of the many disciplines are blended to reach the best outcomes and the satisfaction of patients. Despite the possible aspects of remote cooperation, some difficulties could be to overcome, make it as effective as possible. Effective technical collaboration might be compromised, and even the safety of patients is a question mark due to unclear communication or incompatible platforms, which are related to the technology, and poor internet connection might become problems. The resolution of these drawbacks can be achieved by adopting suitable communication protocols, training the staff on telehealth technologies used so that the work can be safe, and adding backup communication channels. Another critical component in the delivery of remote counseling is privacy and confidentiality. In particular, this is the case in which sensitive topics like personal gender identity are being discussed. Healthcare professionals must abscond to privacy regulations, policy rules, and data encryption standards to assure patient information security during teleconsultation electronic messages. According to Cooper et al. 2020, adopting secure telehealth platforms with built-in encryption and authentication functions will effectively expose privacy risks and assure legal and ethical setbacks. Conclusion. In conclusion, develop an evidence-based care plan for a 25-year-old transgender male with limited access to healthcare services like in a rural area necessitates a comprehensive approach that addresses both physical and mental health needs while considering the challenges of remote collaboration. Blending interdisciplinary competency and evidence-based therapies will help develop the proposed care plan to enhance patient care and safety while promoting a patient and family-centered approach. Introducing evidence-based in dealing with the topic, considering the literature review and expertise of reputable guidelines so that given recommendations are followed precisely the best evidence available and are made in the line with the patient's particular circumstances. Remote collaboration provides many advantages such as access to specialized expertise, multidisciplinary communication, and improved care coordination. Thank you.